Hi, my name is Dr. Afan and welcome to Space Dental. So you've just started your journey and the next step is going to the hygienist. So today I'm going to go through hygiene, and this video I would love for you to take a few minutes of your day to just have no distractions, listen to this video and understand the principles of this video before you come for your next visit, which is going to the hygienist. When you go to the hygienist will have a look at your gums and see if you're suitable to proceed with the cosmetic work. There may be incidents where they have a look at the gums and they say you are not suitable, but they're only doing that with the best interest for yourself at heart. So they will check your gums and see if you're good to go and proceed on to the next step. And if they feel that you're not suitable, they will give you the next steps to make you suitable to proceed, or they will tell you that you are not suitable at all. So this is a very important appointment that's going to happen. But to give you the best position to be able to be suitable to proceed and to make sure your gums and teeth are healthy, we're going to go through the video, and the fundamental principles of this video will help guide you and tell you what to do to improve your gums to the best outcome. So the first thing I'm going to do is go through plaque. Plaque is a biofilm of bacteria on your tooth surface, and if you don't brush it off carefully, it will start to grow on your tooth surface around the gum margins, causing inflammation of the gums and effectively lead to tooth decay as well. So what we want to do is we want to remove it off carefully. Today I'm going to go through how to identify the areas that maybe you're not able to brush fully, and we use a plaque disclosing tablet to do that. So you can go to the supermarket and get yourself a set of plaque disclosing tablets. When you get the tablets, before you start chewing them, just use the manufacturer's guidelines, but some top tips. Get some Vaseline and rub it onto your lips, and that will mean that the plaque disclosing tablet doesn't start to cause a staining of your lips. Start chewing the tablet and then spit out, and what you'll find is there will be areas where the plaque disclosing tablet has got a darker stain around your gum margins, and that's where the bacteria is. So you can actually see where you are missing different parts of the tooth. Okay guys, so I'm just going to go through toothbrushing in particular. So when you're brushing your teeth, get an electric toothbrush. This is an Oral-B one, and with the Oral-B range you can see that the head itself is quite small, and that means it can get into hard to reach places. When you place it into your mouth, instead of opening really wide, try to open a little bit less wide so that you can get it into the back of your mouth as well. So if you open too wide, your lips are not going to be able to stretch and it's going to be harder for you to brush. When you're brushing, make sure that you don't miss any areas, so brush on the outside, the inside and the top biting surface as well, and have it in a systematic way. So don't just think, okay, I'll start here or here. Try to think in your head, right, I'm going to start on the top teeth, I'm going to start on the back for where the wisdom teeth is, the hard to reach areas, and I'm going to come all the way around, and then go onto the inside, then go onto the biting surfaces, now going onto the bottom teeth as well. And when you're using the brush, don't just place it straight onto the tooth, maybe angle it on a 45-degree angle into the actual gums, and that means that you're cleaning them really well. So the reason we recommend a smaller size, and when you're placing the toothpaste on, use a pea-sized amount of fluoridated toothpaste, and that will help to mineralize the tooth surface and increase the cleaning capacity of your tooth. So now we're going to go through any more complex areas. So when you go to your hygiene appointment, the hygienist will focus on these areas and they will go through what you need to do specifically for these areas. But in the meantime, if you feel that there's a certain part of your mouth that's always bleeding, or you think that you've had a restoration like a crown or a veneer or an implant, those areas are places where plaque may form a little bit more than normal. So there's something called a single tufted brush. And these single tufted brushes are smaller brushes, but they're a little bit more firm, and you can get them into these hard to reach areas. And if you just angle the brush on a 45-degree angle and go in small circular motions in that area, it just gets into those areas a lot more than it would do if you didn't do this. So step one, plaque disclosing tablet. And once you've done that, it gives you a good idea of where to brush. Step two, use a normal toothbrush. I would recommend an electric toothbrush to make sure that you've got the oscillating movement on the teeth. Step three, use interdental brushes. And then step four, use a single tufted brush into those hard to reach complex areas. Okay, the final thing I'm going to recommend is a tongue scraper. Now, the tongue actually harbors bacteria as well, and these bacteria can then start to move and migrate all the way around the mouth, causing the gum disease that we want to eliminate and remove completely. So what I want you to do is go to the market and find a tongue scraper. This is one that we've found, and what we want to do is, again, use the manufacturer's guidelines, but put your tongue out and just place it onto the tongue and come down and up to remove the bacteria on your tongue. And do it 3 times and then rinse out, and that's basically your tongue cleaned. Now in terms of brushing, when you are brushing your teeth, I don't want you to rinse out with mouthwash straight after brushing, because that will mean that the toothpaste that you've worked really hard to clean your teeth with is just all vanished. So I want you to spit out, don't rinse out. So there you have it. You've had a great experience today. Hopefully you've enjoyed this and you're ready for your journey to begin with the hygienist. Like I said, if you do these steps, you're going to put yourself in a great position so that when you go to the hygienist is going to look at your teeth and say, fantastic, you've passed with flying colours and we're ready to start your cosmetic journey. But like I say, if the hygienist has a look at your gums and teeth and says, unfortunately, your gums are not suitable to proceed, they will be holding you back and doing further hygiene investigations before you're allowed to start with cosmetic work. And that's because we care about your health and well-being, and this is why we do this. So please just re-watch this video if you have to, do the steps that I've told you, and then we can basically get started on a fantastic journey. See you soon. Okay, so now that you've watched this video, there's one last thing that I want you to do before you go to the hygienist. We're going to give you a questionnaire with some questions, and these are to make sure that we know a little bit more about you, and this will help us navigate your hygiene appointment properly. So fill out the questionnaire, watch the video, and do the exercises on the video, and then we'll look forward to seeing you soon.